present generation of Indian healthcare scenario, we need to know that what is that we are able to offer, what we want to change in the Indian healthcare scenario, and what are the significant effects what are happening in the Indian healthcare scenario. I'll give you some statistics based on the time and time. So this present 2025 statistics may be this, but later on statistics might change. Accordingly, you find out the statistics, and more or less it will be similar. So in India, the problem of chronic disease and patient-centric healthcare approach, which is affordable and accessible and reachable to the people, it is less. So 75% of Indian healthcare scenario, it is a high out of the pocket investment from the patient side. So this has to reduce. So 75% privatization of healthcare, most of the people who wants to invest for healthcare, they'll come and they'll build a big setup or hospital which they'll cater for high-end people or a cream of the society, or it is good for the medical tourism purpose, where outside India, like USA and other people, to reduce the waiting time for the particular elective surgeries or any other procedure, the elective surgeries we can utilize Indian healthcare scenario as a medical tourism to use it for the betterment to build the healthcare model. But for the common people, accessibility, availability, affordability, and accountability of the healthcare profession is lacking, and it is totally focusing on the corporate style of working where your focus is entirely on the revenue generation. And in this particular focus, the focus is totally on the commerce, not focus is not on the patient. So in this regard, if I say that 75% of healthcare is privatized, 72% of rural population and 79% of urban population wants allopathy as a first mode of treatment. But in Indian healthcare scenario, there are other doctors, for example, Ayush doctors, Ayurveda, Yoga, Unani, Siddha, Homeopathy doctors. For this present generation, I think the statistics varies based on the number of doctors coming out of each year. Maybe around 7,78,000 doctors of Ayush doctors are there. But majority of the Ayush doctors are practicing allopathy, conventional medical practice. So this seems to be okay for all the common people, but it is actually not okay. Those people who have studied Ayurveda should practice mainly Ayurveda. They can practice emergency medicine, but it doesn't mean that they should keep practicing allopathy as their primary source of conduct or practice. So this is a problem where this cannot be addressed by any means. Even the government knows, the health officials knows, and Ayush doctors themselves knows what they are doing, but still it is going on. So from one side, the Ayush doctors are working towards allopathy healthcare. On other side, corporate sector are working for healthcare. But both the people, whatever they are offering, it looks like they are offering something towards sick care system, not exactly towards healthcare system. So this needs a revolutionized focus on the patient centric approach where you are making the things affordable and accessible to all the people, or you come in between the corporatization and the offering something for free. So healthcare cannot be totally free. So there will be out of pocket investment, but it can be reduced significantly by introducing integrative services, wherein a conventional medical doctor is practicing an adjuvant therapy which are based on the evidences from any streams of medicine like traditional Chinese medicine, medical yoga, acupuncture, Ayurveda, or any source of manipulative therapies, mind body therapies. They can incorporate into the present healthcare scenario or the disease and bring the better version of the healthcare where you are also focusing on lifestyle, preventive health services, and adjuvant therapies and mainstay of allopathy medicines. So there is much more deep to learn in this integrative services, what we are offering and what others are also offering. But for Indian healthcare scenario, if you find anywhere the healthcare system is claiming to be integrative or claiming to be high-end uh, healthcare services, just go with the flow of your intuition and intellect, find out which are the doctors, what they are offering, and are they eligible to practice what they learnt? So are they practicing what they learnt, or are they practicing what they have not learnt? So choose your doctors wisely and promote more of the lifestyle based preventive healthcare services. Adopt a healthy lifestyle, adopt a better diet, and all the best for all of you. In a further upcoming video, we'll see much more details in this integrative services.